Welcome to the Journal Club for this week. This article, titled The Effect of Novel Cryotherapy Technique on Postoperative Pain for Pulpotomy in Permanent Molar with Symptomatic Irreversible Pulpitis. It's a randomized controlled trial which was done by Turkish group and newly published in the JOE. Management of postoperative pain in endodontic practice is important. There was a lot of previous study aimed to control postoperative pain using various treatment strategies, including the use of analgesics, antihistamine, corticosteroid, occlusal reduction technique, low-level laser therapy, local anesthesia, and cryotherapy. Cryotherapy has recently gained popularity as a technique for reducing postoperative pain in endodontic practice. Cryotherapy aims to reduce the temperature on the tissue, which decreases the nerve conduction velocity, and in this way, inflammation, bleeding, and edema with the number of leukocytes adhering to the endothelial wall of the capillary will reduce. So, this study aimed to evaluate the effect of application of cryotherapy with cold saline on post-operative pain after full pulpotomy procedure in patients with symptomatic irreversible pulpitis and permanent molar. Coming to the material and method, this study is a single blind randomized controlled clinical trial which included 42 female and 24 male patients who aged between 14 and 60 years of old. All of them were healthy patients and had a permanent molar with symptomatic irreversible pulpitis. For their inclusion criteria, they include the patient who had first or second maxillary or mandibular molar, with moderate to severe pain score according to VAS score, teeth which responded positively to cold or electrical pulp test, and who responds negatively to percussion and palpation, and teeth without periapical pathosis. They exclude teeth that require post-core restoration, and teeth with periapical pathosis radiographically, tooth with poor perio condition, and patient who had bleeding disorder. All endodontic procedure was performed by a single operator under magnification and illumination. They had two groups, control group and cryotherapy group. Both groups had received local anesthesia and rubber dam isolation, followed by the pulpotomy procedure. And then the exposed pulp tissue was irrigated with 5 milliliter of 2.5% sodium of sodium hypochlorite. After achieving hemostasis, the cryotherapy group had 5 minutes irrigation using normal saline, which was kept in a cooler at 2.5 Celsius degree, and they verified the temperature of 2.5 Celsius using a digital thermometer during the irrigation. They kept the needle 1 to 2 millimeter above the orifice, and they had the irrigation done with continuous circular motion. In both group, the experimental and the control group, they received 2 to 3 millimeter of MTA, followed by GIC and then final composite restoration. Also, both group, they prescribed 400 milligram of ibuprofen after the treatment, and they are instructed to use it if necessary. Then the post-operative pain observation was evaluated by a blinded researcher using a questionnaire on the base of a VAS score at 6, 12, 24, 48, and 72 hours. All patients were called for a clinical examination at 72 hours. And for their result, 62 patients were available in the follow-up, and there was no statistically significant difference in the post-operative pain score between the control and cryotherapy. There was no statistically significant difference between the control and cryotherapy in terms of demographic data, which include the gender and the tooth location between the two groups. Also, in the post-operative pain score at 6 and 12 hours, there was significantly lower scores in the cryotherapy group in compared to the control group, while at 24, 48, 72 hours, there was no significant difference between the two groups. Also, there was no significant difference in analgesic intake between the two groups. So to conclude, using the cryotherapy after achieving hemostasis in vital pulp therapy reduce post-operative pain in teeth with symptomatic irreversible pulpitis. And also from this study, cryotherapy consider a beneficial strategy to reduce the pain with the ease of application, the lack of toxic effect on the tissue, and it is a cost effective strategy. And thank you.